Good evening, I'm John Samuel, physical therapist from India. Today I'm going to share with you about the importance of monitoring and considering the perceptual issues, the perceptual deficits, the perceptual dysfunctions whenever we are treating the patients with the neurological disorders, especially with the stroke and other disorders which involves the cerebrum, the cerebral cortex and the brain. And the perceptual problems like the unilateral neglect, the agnosia, the finger agnosia, apraxia, and the space disorientation, and these are the problems that cannot be externally manifested. As a clinician, we would always tend to measure the patient's improvement and the patient's recovery on the basis of the external parameters like the voluntary motor control, the muscle power, and the coordination, and the balance, and how the equilibrium is improving, and how the patient is able to perform the activities of the daily living, and how they are able to maintain the movements within the bed and around the bed and within the room. And these are the external parameters. But at the same time, we should not forget to consider about the perceptual issues, the perceptual problems that the patient might have. For example, the stroke patients, sometimes they can have the unilateral neglect. The unilateral neglect that will make the patient to completely unaware about the paralyzed side. If, for example, if they have the unilateral neglect on the left side of the body, they will not be able to identify that is their left side, and they will not always be aware. They will always not remember about their left side. They affected the paralyzed side. So whatever the treatment that we may give, so we should always have in our thought that this patient may have the unilateral neglect. So for that, we have to perform the simple and the effective and most accurate the clinical examinations to find out this unilateral neglect. Some patients, they may have the apraxia. The apraxia is a condition where the patients, they will be able to perform the skillful voluntary movements on their own. But when we are, as a clinician, when we are asking them to do those skillful voluntary movements, the purposeful voluntary movements on the command, the patients will not be able to do. That is the apraxia. And the patients, they might have the good, the normal sensory, normal sensation in their body, and they can have normal muscular strength, the muscle power, the voluntary motor control, as well as the coordination. But because of this apraxia, the patient will not be able to perform the movements on command in a skillful way. And some patients, they may have the finger agnosia. The patients with the finger agnosia, they will not be able to exactly which finger what we ask them to name. So these are the various issues. Some patients, they may have the space orientation problems. So many other the perceptual issues are there. These perceptual dysfunctions will have the the maximal impact on the patient's recovery. So if we fail to identify these perceptual issues, the possibility of the perceptual issues in the patients, surely we will not be able to give the effective and most accurate therapy that will ultimately affect the prognosis of the patient, that will affect the recovery of the patient. And so when we are performing these simple clinical examinations, and when we are considering the possibility of these perceptual issues, we can better understand about the patient's issues that they will not be able to express in words, or they will not be able to express with their command. But these issues surely will have the maximal impact. For example, if the patients with the unaware about their paralyzed side, they will not be able to what we are telling them to do on their paralyzed side. And it's a very the bizarre experience. It will be a very bizarre experience for the patients. So we should always have the consideration about the perceptual issues. And when we have identified that our patients, they have these perceptual issues like the agnosia or the unilateral neglect or the apraxia, we will be much patient with our patients, and we will be able to provide the better the tactile perceptions and better commands and better better techniques which are very needed for them, and it will yield the greater improvement on the patients. And moreover, we will also be able to give our therapy in a patients with a great sympathy to the patients and with a great love and compassion. and surely it will help, it will impact them, it will impact to a greater extent on the recovery of the patients and on their life. So as a clinician, as a physical therapist, or as a physician, as a doctor, and we should always have in our mind to consider about the possibility of the perceptual issues. Even in the patient's home, the family members, they should also be educated about the possibility of the perceptual issues that will help them to know about their family members in a better way, and what are all the issues that their family members have. So how they can help their family member who have affected with a stroke and other brain disorders in most efficient and most effective and most compassionate way. That will yield the greater improvement in the patient's recovery and the prognosis.